Hi,
Great.
everyone. I have here with me the lovely Camilla Scher. Hi, Camilla.
Hi, Eugenie. Thank you for having me.
It's so lovely to have you here. I just want to say, so Camilla is the co-founder, along with her husband, Jeremy Scher, of the charitable organization Homeopathy for Health in Africa, which was started in 2008. So you've been going for a while. And we've had one of your amazing volunteers, Rebecca Stirrup, on our podcast.
Mm.
And you've also featured in the homeopathic documentary Magic Pills. Now, as you know, Friday, the 12th of August is Homeopathy Hangout Podcast's 100th episode. And we are having a big party here in Perth. And each of our 100 guests that are coming along have paid $10 for their tickets. And the $1,000 we've put together, we are donating to Homeopathy for Health in Africa.
Thank you so much.
Oh, it is
Really.
such a pleasure. The work that you're doing is amazing. I know we're doing a special little series with Rebecca at the moment, and she's traveling to the different places in Africa, and we're doing live recordings where she actually goes to visit some of the locals that you have trained up to be homeopaths to actually work in their own communities. And it's been so amazing to see. One of the places we were at, there was a little boy there with leukemia, and she was saying how Homeopathy for Health in Africa had built this boy and his family a house. And there was this other little boy who had a really massive hernia. I've never seen anything like it. And your organization helped him to have that operation. And just the way that you empower the locals to heal their own communities with homeopathy and the agro homeopathy side of things. When I was chatting with Rebecca, I saw the cans there with the agro homeopathy helping
Yeah.
them to, heal the land as well. So I think what you're doing is amazing. And I know that this money is going to go a very long way. I want to ask you, Camilla, how can people help your organization more? What are some ways that they can get behind the amazing work that you're doing?
Well, I mean, money is great. What can I say?
Yeah.
It helps. It's, in situations that we need to keep the operation running. So there's running costs. So to become a monthly donor is probably the best way for us, because then we have it creates a framework. It creates a baseline for the budget. And we're a very shoestringy operation. So when we do things like that hernia operation, for example, which is, of course, not homeopathic at all, but, you have to do what you have to do, and I'm a great supporter of integrated medicine. I believe that there's a time and a place for everything. So in that kind of situations, I reached out for the community on Facebook and got the money together in 2 days. So that was really, really, really amazing and brilliant. And it changed the little boy's life. So, but I really feel that, we're actually a very boutique kind of an operation. We're not UNICEF that goes and digs 200 wells in Africa. We're very highly individual, and we go with what is there. So we have our framework and our organization, but then we look at each patient, each situation, how can we really improve this family's life? So for example, where we built the house, it improved, we treat the whole family. And they were living 5 people in one room that didn't even have proper walls or anything. And they were freezing in the winter and boiling in the summer. And it was awful. So just by providing that kind of an environment where you can heal, how can you heal if you live in something like that? It's very difficult. So, and we provide food parcels where food is needed. You give a remedy, and then as a result, the appetite comes back. But now there's no food. So what are you going to do? You have to buy them food, because there's no social services. There's no, there's no one who's going to come and pick up that bill and help like we have in the West. It's a very different situation. So for all of this, we need money. We need money for food parcels. We need money for petrol to get to all these outreach places, because many of them are far. We need money to repair the cars because they break all the time because the roads are horrible. And we need money, for not so much for remedies per se, but for translators, for travel, for getting there, for salaries for our homeopaths, for electricity. It's basic stuff just to run the operation. And hopefully in the future will be sustainable. But as long as we do social work as well, we can't be sustainable because it's, where's the money going to come from? There's no tax money, there's nothing like that. So actually, from that point of view, we depend on donations.
And I am a donor as well. And it's only, $20 a month is nothing. It's absolutely nothing, like it's 4 coffees. So yeah. I pay that with a smile. And if we can just get a few hundred more people to give $20 a month, it would make such a huge difference because, $20 a month in Tanzania goes a long way. And,
it really does.
I always say Homeopathy for Health in Africa, you don't go out and spend like millions on advertising like UNICEF and those people. You have it's a shoestring budget. The money goes directly to the people who need it most. And you said you're like a boutique charity. You can't help the world. But I tell you what, when you help that one person, that means the world to them. So the work that you're doing is really amazing. So I guess just go to the website, homeopathyforhealthinafrica.org, I think, and you can sign up there as a sponsor. And you also have this legacy program where people can write your organization into their will so that if they pass, that money can go to you so you can do even more amazing work. So yeah, I would definitely encourage people to go to the website and sign up and follow the Facebook page, because if there is an emergency situation that like this little boy who urgently needed this hernia operation, then people can know about it and they can sign up for your newsletter if they want to be informed of all of this as well. Hey.
Exactly. All of that. So just go to the website and see what we do over there, and go to the donate page, and you will see the options of being a monthly donor or a one-off donor or whatever else there is to do. And there's also examples of, $20 does this, $10 does this, etc., etc. So, you can choose what you want and how you want to give.
Camilla, I know you're a busy lady, so I'll leave you to it. Thank you so much for your time. I'm going to go to the party now.
Thank you so much. And thank you so much for doing all these incredible podcasts where you are making homeopathy accessible to people. It's really, really wonderful. And, from the community, from the homeopathic community, from all of us in HHA in Tanzania, we really, really, really thank you. And we thank your listeners. And keep up the good work.
Thank you so much. I can't wait to have you on the show soon.
Thanks a lot.
Bye.
See you soon. Bye.